For the next exercise, first we will put ball between the legs. It's all the same like you did it
Yeah.
in the previous program. So basically, I just put
I started to use, normal medicine
bandage.
bandage
Yeah,
because
you
I
can.
saw it in Belgrade
Yeah,
that,
you
that
can.
you
For me, it's
are.
much easier like this because I just put his, I close, and then I finish.
Okay.
You can use it normal.
Yeah, but they used also this direction.
Yes, because sometimes ball
Yeah,
can
exactly.
Like, okay, so that's why I'm not using it.
Okay.
Depends from kid to kid. I want
Yeah.
to save the time. Here, what we're going to do on the chest, we will put one bigger towel. You can put 2 of these yoga mats.
Yeah.
Now, on the chest, we will put one ball.
So this Sophie.
Is going to be from the side of his chest, and you will roll to the middle, or you will do with your arm. So from the side, see, there I put, and then you go to the middle.
Also from
From here to middle. If you catch the shoulder, it's also okay. Don't worry, just not to be, of course, on the neck.
yeah.
So that's one movement that you need to have. Now, under the legs, we will put some ball. Pilates ball. Here, you will hold his knees, and you will do rotation toward your body. So you will do slowly like this. But his back needs to be on the floor, so not to do like this. No? So you do a little bit until you feel some resistance, and then you stop. But you're going to do at the same time. This ball goes there. So it's something like this, you see. I do the pressure here on the ball, slowly. I do the pressure there. Now, when I go to the middle, I'm also rotating.
So I start to rotate when I go
Yeah, when
come
you
to
start with
middle.
this, yes. And you wait for 5 seconds. After 5 seconds, you release, you go back. So again, you do it slowly. You go there. Slowly you start with the movement.
And how much you tilt until he can? Or
No, if you go too much, you see, then his spine will be off. So we don't want to have that kind of movement. So you basically go, let's say like this, for you to be easier. Maybe when his knees come a little bit to the middle.
to the mid.
It's a little bit more than the middle line of his body. You do one side, let's say 7.5 or 10 minutes.
Yeah.
Then you do the same, you just come to the other side. Now, you put the ball from, of course, other side of the chest. What else you can do? You can maybe use one towel to put on the ball, between the ball and your arm. So I hold it here, again. I do the pressure slowly. Go to the middle and I start to roll. And you stop for 5 seconds. Then you release and go back. It's good to have control for his knees, not for this area, because if you do it here, then you will see, you will create like rotation of the pelvis. See? And you will make the movement in the hip joint, but when you do it here, then you have the movement of
So it must be
pelvis.
straight,
Yes.
not.
Yes.
So I start to do with legs in the moment when I'm in the middle
Yes.
with ball.
Yes.
So I'm not doing it
You can-
in the same.
You can do it, you start with the pressure, and you see, because the movement is very short. So
Yeah,
basic. So basically,
maybe
when-
5
when I
centimeters.
start, you just continue with this, and you stop.
And in Belgrade they did it also with this ball.
Yes, it depends. Now,
Yeah.
this
so-
time it's with the Pilates.
Okay.
Sometimes it's this small one. Depends how we decide. If you see that his legs are going out of the ball,
Yeah.
just put some bandage. But they don't need to be like this. They don't need to be together. They can stay like this. So basically,
yeah.
just give him some
Maybe
limitation.
some small ball, some
And you put
soft
a small
ball.
ball, then it's going to be maybe big, like this. It's going
No,
to
no,
be
no,
hard.
like this, you
Yeah,
know.
no, but then that ball also will be there. And it's going to make a bulge. You can try, but you can just put some regular bandage, maybe some towel between some. But he's, you see, he's very stable. So I will not do anything there.
Okay.
So basically, that's the first exercise. And the